The News Hour Special Edition.
Welcome back to the big story breaking first on Times Now. Jab for kids between age 12 to 18 has been improved. Emergency use approval has been granted by the Drug Controller General of India to Bharat Biotech's co-vaccine. Dr. Gilada, before we took a break, we are discussing an important aspect. When we have the assets, why not use it to cut the delay?
I think India is a very strange country. Vaccination can occur in community halls, in religious places, in boats, in parking lots, in cars, at homes, but not in clinics, not in nursing homes. So I think it is such a ridiculous thing.
Okay, big news coming in. I'm sorry to cut you off, Dr. Gilada. Prime Minister of India handle on Twitter has just tweeted in about 15 minutes, Prime Minister Modi will be addressing the nation. Big news breaking first on Times Now. In about 15 minutes from now, Prime Minister of India will be addressing the nation. This is the tweet by PMO India, breaking first on Times Now. This is the tweet, and we'll shortly put out the tweet on screen. Just moments after the development, we can now confirm that in about 15 minutes from now, which is at about 9:45 to be precise, Prime Minister Modi will be addressing the nation. We don't know what the message will be, but this is big news. Dr. Gilada, what do you think? Will this be on vaccines?
Yeah, this will be on vaccine, of course. There cannot be anything else than vaccine and current Omicron. Because if you look at how Omicron is spreading, if it is WHO saying every 2 days doubling or every 3 days doubling, if it doubles every 2 days, with a simple calculation, we'll have 6 lakh cases per day by 15th of January. If it is doubling every 3 days, we'll have 6 lakh cases per day by 26th of January. So we have no time to lose. And already Covaxin is available at all the places. So I think we can start vaccination right from Monday, if that is agreeable to people, because vaccines are available, stock is available. We can order some more stock, but current stock is available. So we have no time to lose. Am I clear?
Do you agree with what Dr. Gilada is saying?
If I may come in, I think we'll have to be sure that the vaccine that has been granted permission is the same Covaxin dose. And like, for example, when we are giving the Pfizer vaccine to younger children less than 6 years, it is a much smaller dose which is being given, although more than 12 years it's the same adult dose. So once that clarity is obtained, we can decide whether the same Covaxin dose and the Covaxin vaccine can be used, or is it somewhat tweaked and a somewhat different vaccine which will come for children. That has not yet been clarified.
No, the dose is same. In the first phase 1 and phase 2 trial for pediatric population, dose is same. That is 0.5 ml per child. We were asking that they should have done a parallel trial of less dose and the same dose. They have not done that trial. So if the dose is approved, the vaccine is approved now, it is on the same dose it is approved. And they can immediately start vaccination of children. And it can be staggered manner. It can be children between first 12 to 17, children with comorbidities, or children with comorbidities at home. So I think we can decide which can be, but we have no time to lose.
Dr. Manish Manan, HOD Pediatrics, Paras Hospitals also joining us. But Manan, I'll come to you. Megha Prasad, the senior editor, is joining us. Megha, the PMO has put out a tweet. In about 15 minutes, Prime Minister Modi will be addressing the nation.
That's correct. The tweet has been put out just 4 minutes back and looks urgent. It just says, it's just one line. It says in about 15 minutes, Prime Minister Narendra Modi will be addressing the nation. And from what I understand, Pranesh, this is going to be COVID related. There isn't anything which is that urgent for the Prime Minister to all of a sudden decide to address the nation and perhaps make an announcement important enough. So 2 things I think we should be absolutely clear about, that this is not, one of those speeches where a hand-holding exercise is done. The speech that was about the 100 crore vaccine, etc. It's going to be an announcement, most certainly, an information that he needs to share with the country. That's number one. And 99% is going to be COVID related, because that's what we're dealing with. Prime Minister held, remember this day before yesterday, Pranesh, he held the meeting with all the secretaries of the government of India, including his PS to PM and the experts from the NITI Aayog. You had Mr. V.K. Paul, everybody. So yes, there was a situation which was developing. Clearly,
And
they are,
allow me to
the government is privy to.
because we have big information coming our way, and top sources are telling Times Now that a booster dose could be available by January. Booster dose likely by January. Top sources telling your channel that the government is considering expert inputs and booster could be available in New Year. By that calculation, the inputs of experts say 9 months gap between the second and the third dose, and by that calculation, Megha, by January, February, booster dose could be due. The government at the moment is assessing availability from domestic sources to plan the rollout. Another consideration is of covering 70 to 80% population on first dose. So the biggest scoop on boosters breaking first on Times Now. Megha.
Well, Dinesh, there is a possibility. There is a possibility that this could be, about the booster dose. We can't be absolutely sure, but let me tell you that the other day, and yeah, there are two important things we must, let our viewers also know about this. The government of India, by way of Entagi, through Entagi, is already in the exercise, involved in the exercise of, going around and checking for the effect that a booster dose has on people who've already taken the 2 doses of COVID, especially those whose second dose got over 6 months back. That particular study and research is currently going on right now. Now, as far as we understand, that was one of those things which was discussed in the meeting. We were expecting some sort of a clarity on the booster dose day before yesterday. It didn't come. There is a possibility, but we cannot be absolutely sure that that would be the case.
Okay, just stay on with us because in about 7-8 minutes now, the Prime Minister Modi will be addressing the nation. And Dr. Gilada, I will come to you, but I want to once again underline this piece of breaking input on Times Now. Top sources are telling our channel that booster dose likely by January, government considering expert inputs, and the suggestion from the expert group is that there should be a 9-month gap in second and third dose, and going by the input of experts, by this calculation, by January, February, booster dose could be due. Now, Dr. Manan, what do you make of this?
So, abroad, in Europe and America also the booster doses have already started, and certain studies have shown that booster dose is probably helpful in tackling the new variant that is Omicron. We don't know how it's going to unfold in India because a lot of our population has already been exposed to the Delta variant, which would probably have given a lot of T-cell immunity as well to the population. But yes, in view of the present circumstances, it's a good idea, but I would want to reiterate that first, the whole population should get the 2 doses. I think that is more important. And then the booster doses should be rolled out, and hopefully they'll be rolled out for the frontline workers first. And in a phase-wise manner, then it will go to the rest of the population. This shouldn't happen that a good section of population hasn't got the basic doses and we are giving booster doses to rest of the population. So this is my take on this.
Dr. Chub, do you agree with that?
Well, I think both things can go on simultaneously. While we are trying to cover up the whole population, that should continue. But booster dose is absolutely due now. We are already somewhat late in that. On 16th of January, probably we started giving the first dose last year. And that could be the day that we can start the booster dose or even earlier.
Okay. And Dr. Gilada, what do you think the Prime Minister, your guess is as good as mine. Do you think this is a message to the country, perhaps to underline the need for COVID curbs, need to up our guard once again?
I think Honorable Prime Minister will speak about 3 or 4 things. Number 1, the Omicron fear loom at large, and people should behave properly, get vaccine if they are vaccine hesitancy. Secondly, pediatric vaccination. And thirdly, booster for frontline workers, whether medical or non-medical, or those which are with severe comorbidities or some kind of poor immunity. So I think that should be the message, and good that Honorable Prime Minister is giving this today. Otherwise, if it is delayed by a week, it would have been next year. So currently we are talking about 2021, and if we are delayed by a week, it is 2022. So I think it's a good omen, and let us see what is in store. But doctors and frontline workers require booster for two things. Number one, they have been vaccinated almost 9 or 10 months back, and secondly, they are day by day exposed to high vaccine load, high viral load people. And lastly, is the booster mechanism, the confidence building mechanism. That you are given booster, now be ready. If the Omicron wave comes, be ready for tackling patient. Otherwise, a lot of doctors also develop hesitancy. They don't want to work. They are already scared of. Some of them are already scared of working because their immunity has gone down. Doctors, being a medical community, they get their antibody test level done, and little bit antibody level is down. They are scared. So I think this confidence building mechanism, the bigger thing can be just booster. Like people going in war, they are given a tika. But tika doesn't make you win the war. But that is a confidence building mechanism. Look, you go, we are behind you.
This is important what the Prime Minister will speak in his address to the nation, because this comes at a time, Dr. Chugh, that states are now falling back on curbs. We've seen large-scale restrictions across the country by state governments, and the centre is also monitoring the situation very, very closely.
Yes, certainly it is required. Now that we know that Omicron has started spreading, and we know that its spreadability or infectivity is much higher compared to the Delta or the previous Wuhan viruses, we have to start bringing the curves again. Whether they should be as strong as they were in the very beginning, that can be debated, but certainly some curves are in place and should be in place very soon. If not tomorrow, it should be maybe by 1st of January. In almost all across the country, in fact.
Okay, Megha Prasad is back with us. Megha, in about 4 to 5 minutes from now is when the Prime Minister will be addressing the country. What is it? In about 1 or 2 minutes now, in fact.
Pradesh, my sense here, Pradesh, is two things. Yeah, one, a very strong speculation has been around the talk about the vaccine for children. Remember, Prime Minister last time around when he was addressing the nation, a week before that, we had heard from very credible sources in the Health Ministry that, it was at the insistence of the highest office that the clarity about the vaccine for children, since there was no clarity and there was a lot of, discrepancy about, whether we should be going ahead, not going ahead. There was confusion, experts were saying different things. So the PMO had intervened asking for, a final conclusion whether kids can be vaccinated or not, and how should the entire plan be rolled out, etc. My sense here is that that is one of the things you could hear today. Possibly you could hear today, about India launching its vaccines for children. We still haven't done that, despite the fact that it's ready and it's ready to be administered. Yet the clarity, when it came to the experts, that consensus was not being able to be built upon that. That's one. The other, of course, is the booster dose. But my own sense is more about the vaccines for children, less about the booster dose. The booster dose study is in place, is right now being conducted, so it's in the process. I don't think we've heard the last on that.
मेरे प्यारे देशवासियों, आप सभी को क्रिसमस की शुभकामनाएं। हम इस वर्ष के अंतिम सप्ताह में हैं। 2022 बस आने ही वाला है। आप सभी 2022 के स्वागत की तैयारी में जुटे हैं, लेकिन उत्साह और उमंग के साथ ही ये समय सचेत रहने का भी है।
After 6 months, it starts coming down. So I think it's a very good move. It is a game changer for the health of the country, most definitely.
Thank you, Dr. Naresh Trehan, for speaking to Times Now and for sharing your views on that. Dr. Bagai, just a little while ago we were talking about this, and look, it is now a reality.
This is extremely good that when look at the timelines, the pediatric population 12 to 18 on 3rd Jan onwards, and the word used very carefully and judiciously and craftily is a precautionary dose. So he has removed the word, PM Sir has removed the word as a booster and a 3rd dose. It is to give comfort to say that this is a precautionary dose, and stressing that 2 vaccines have done a lot of good. The message is that the 2 vaccines have done a lot of good, and for the specific categories of above 60 with comorbidities and healthcare workers, these 3 large segments would get the 3rd dose. But like we were discussing a few minutes back, the pediatric population to be immunized is extremely important. It is the largest chunk. They carry the same viral load. They transmit as much as adults. And this would be a huge link to stop the chain of transmission. And this would prevent the risk to children, get them back into school, get them back into sports, and have to have more in-person contact. That's the most prime responsibility of parents and teachers for children.
Okay, let me get in Dr. Manan, Dr. Chud, Dr. Gilada. They're waiting with us patiently. Dr. Gilada, I'm coming to you. You were the first to raise your hands just after Prime Minister finished his speech. Yes, sir, go ahead.
I had to leave. I would like to just congratulate Prime Minister and the whole country that today he was speaking our language. It is like we are speaking. So one of the good things to happen. And as I predicted, all those points which were expected of him, as a head of the nation, he spoke about that. About 60 and above population with comorbidity, it will be almost all the 60 and above population, because almost 90% of the people at 60 and above, they have some or the other comorbidity. So it is a additional dose for them. It's not a booster. Actually, it is not called booster. But for medical caregiver, frontline workers, I think best thing to happen, because that their confidence was shaken. So last 1 month they have been campaigning, but it was not happening. So good thing it is happening, and he has given a timeline. Actually, we want this thing, timeline, transparency and systematism. So like we started vaccination in a systematic fashion, similarly the booster dose, additional dose, etc. should be also systematized. So I think one of the best things to happen, and I think people will also now cooperate with the COVID appropriate behavior during this Omicron wave, and will come out victorious. I have no doubt about that.
And Dr. Chur, allow me to understand one thing, sir, and please correct me if I am wrong in my assessment. Is there a difference between precautionary dose, the phrase that Prime Minister used, the 3rd dose or the booster dose as it is being called?
No, there's no significant difference. I think it's just a terminology. Ultimately, it's a 3rd dose which is being given, and as has been seen world over, the immunity does start waning as far as the antibody levels are concerned after a few months, and by 12 months we expect it to come to a level where it will again be vulnerable, and it is just the right move. Just as I was saying, the 16th January could be the date that we should start getting our vaccines, and if it is somewhat earlier as announced by the Prime Minister, I'm happier. So this is required. Both precautionary dose and booster dose are the same thing.
Dr. Manan, 3 important announcements by the Prime Minister. He said from 3rd of January 2020, rollout for vaccination for people aged 15 to 18 years of age. Frontline workers will get their 3rd dose, the booster dose, precautionary dose, call it what you want to, from 10th January 2020. And people above the age of 60 years with comorbidity and on advice of doctors will also get the booster dose.
Yes, this is something which was expected, and we were hoping that this would happen soon. Booster dose, we have been waiting for a very long time. It's been happening all around the world, and it's a welcome announcement from the Prime Minister. Yes, pediatric vaccinations, we were expecting that they'll go very slowly because safety aspect has to be seen. And very rightly he has said we'll start from 15 to 18, and then gradually we will probably go up down the ladder till we reach up to 2 years of age. So a very welcome announcement, and very important thing Prime Minister has said, that be prepared but please do not panic. He's stressed this many times. So no panic, be prepared, be cautious, and yes, vaccination is the key and the answer to this particular pandemic. And I think a welcome announcement by the Prime Minister, and I'm happy this announcement has been made on Christmas.
Okay, let's play out if we can. Okay, we'll go to that in just a bit, but Dr. Jailal is back with us, President of the IMA. Dr. Jailal, what do you make of the three important announcements by Prime Minister Modi?
Yeah, as usual, on behalf of the doctors' fraternity, I welcome the announcement of Honorable Prime Minister Ji. This is what we are expecting him from today. And thanks for him coming forward and acknowledging the service of the frontline doctors in this community in the COVID war, and giving them the additional dose of the booster vaccination at this moment, and also for the immunocompromised people. This is long expected. I am sure as in the imminent of the Omicron wave, which is pertinent in our country, definitely the supporting and precautionary measure taken by the government to support the booster, the immunity of the doctors will be going a long way in sustaining the health status of our country. I'm also happy, and we thank the Honorable Prime Minister and the Government of India for announcing vaccination for the children, especially 15 to 18, to start with of January 13. And we, on behalf of the doctor fraternity and from the pediatrics across the country and the family physician, we assure our full-hearted support to the government in implementing the vaccination drive in the country, and the nook and corners of our country shall be receiving the vaccination. Especially during the pediatric vaccination, we need to take utmost care and utmost monitoring capacity, not like adult vaccination. Even if there is a small mistake, there is in the in the super medias, it can be go wrong way. So there must be a close coordination between the medical fraternity and the implementation of this vaccination. I'm sure this will help as the schools and colleges are open. Definitely when the children are going to the schools, and they will feel happy. Parents will be also extremely happy to have this vaccination. So we thank Honorable Prime Minister, and especially his advice on not to get panic but be cautious. If the government should be also take care for the precautionary measures of avoiding the confrontation of the crowded community at any level in the society. Right. And Dr. Bagai, you know what, I want to come back to you on one specific point that the Prime Minister stressed on in his address, sir. He said that this will strengthen the confidence of healthcare and frontline workers. And this is, I think, by far the most important aspect to focus on, because these are people who are at the front line in fight against COVID.
Absolutely, Pranay. The healthcare workers in India actually got the vaccines, the 2 shots in January and February this year. So it's been a better part of about 9.5
I'm sorry to interrupt you. If you have a light in front of you, maybe you could switch it on, because your frame is too dark, sir.
Can you have the light? Yeah, I'll just do that, Pranesh.
Yes, sir.
Yeah, is that good?
Much better, sir. Go ahead.
Yeah. So most of the doctors have actually got the vaccine about 8 or 10 months back. So most international studies have shown that the vaccine immunity 6 to 7 months after the second dose diminishes rapidly, especially for the AstraZeneca. And there have been case studies after case studies to show that you need a third booster dose. And there is a medical and scientific reason, because it stimulates what we call as the germ cells to reactivate your antibody to produce T cells, which are your main long-term protective T cells, memory T cells. So this is an extremely important step, because the doctors need the utmost protection, because we are the caregivers. And we've already lost close to 2,000 doctors in the first and the second wave. And the last thing which we want is any more mortality, not only medically, but in the society at large. So I think all the categories which the Prime Minister, sir, has mentioned, which includes the elderly, the vulnerable, the comorbids, healthcare workers, are extremely important. This is a huge mental boost for them, not only an immune boost, but a mental boost for them to know that the country is with them. The Prime Minister, late hours at night, has approved this. He's announced this, and from 3rd Jan and 10th Jan respectively, both the pediatric vaccination and the third shot, which is called very smartly the precautionary shot, because this removes the doubt in people's mind that the 2 shots didn't work. So this precautionary word is actually used, I presume, from that context. But I think it's a huge moral boost for the parents too, whose young children have been locked up for the last 2 years and doing online courses. So this will again give a huge mental confidence to them to know that the children will soon be able to go back to school.
Dr. Manan, before Prime Minister Modi made the announcement, the 3 big announcements that we've been telling our viewers about, he underlined the fact that this is no time to panic. We just have to up our COVID guard. We have to stay alert. That's our best bet.
Yes, absolutely. So, the words like panic, alarm, screaming, I mean, that should not be used. We should be cautious, we should be prepared, we should not panic. See, we are already in a very good situation, I think. We have faced the Delta variant. 141 crore vaccinations have been given across the country. Booster doses have been announced. We are starting vaccination 15 to 18 years. I think we are in a very good situation. If we just follow the basic COVID protocols and stay cautious, I don't think we'll face the problem which the West, I hope so at least, which the West is facing. Also keeping in view the demography of India and Asian countries. This is my take. So, absolutely, no panic. No panic, just be prepared, be cautious and be healthy. I think that is also very important.
Absolutely, because COVID appropriate behavior, is important. It is important to follow it, Dr. Chugh, because at a time when most state governments are imposing curbs, are saying that containment must be our focus again, here you have the Prime Minister addressing the nation to just drive home that point.
Certainly, I think coming from him, it has far more impact than coming from even the medical fraternity or the state leaders. So I think it's a very good move that he's emphasized there. In fact, he started with that although numbers that are going to come are being already projected regarding Omicron are alarming and very, very alarming. They are saying there could be 14 lakh cases a day. These are calculations, and this is what Dr. Vinod Paul had said a few days back. If that can be the number, it is frightening. On the other hand, somehow I feel, in spite of listening to that numbers, in spite of seeing cases around our neighborhoods, most people are not taking the appropriate precautions. And it is time that we go back to what we were several months back. And maybe
absolutely. Well said, sir. Times Now Newsbreak confirmed 15 minutes before Prime Minister's address to the nation. You heard it first on Times Now. With that, a short break. We return to this in just a bit. Please stay with us.
ये भी 10 जनवरी से प्रारंभ होगा। साथियों, मेरा एक आग्रह है कि अफवाह, भ्रम और डर पैदा करने के जो प्रयास चल रहे हैं, उनसे बचना चाहिए। हम सभी देशवासियों ने मिलकर अब तक दुनिया का सबसे बड़ा वैक्सीनेशन अभियान चलाया है। आने वाले समय में हमें इसको और गति देनी है और विस्तार देना है।
You heard what the Prime Minister said. 3 important announcements. Dr. Bagai, Dr. Manan is with us. Dr. Bagai, we have been talking about it for weeks now. And in fact, 15 minutes before the Prime Minister's speech, we told our viewers on Times Now that booster doses will be rolled out.
Yeah, I think you clearly have taken a lead in all along for many months. In fact, just last week, a couple of really good, robust show that the third dose actually required. But I want to stress on the word as precautionary dose. So the message really in this word which has been used is that there are 2 vaccines which have been so far into the Indian citizens have worked. They have prevented serious disease and death. The booster terminology gives a connotation that your first 2 didn't work and therefore I'm giving a third. So I think this has been very craftily used. The message is no panic, no misinformation, no vaccine hesitancy. Make the 1 vaccines into the double vaccines. The double vaccines now, the given 4 categories get a third shot. The pediatric vaccination announcement, there is going to be a huge impetus because children get vaccinated in almost every center. We've been doing it now for decades. The immunity response is excellent. There are practically no side effects. This can be inculcated in the Indian Association of Pediatrics routine vaccination campaign. And I think this is going to stop the chain of transmission and build the chain of immunity.
Now, Dr. Manan, help our viewers understand, sir, that what will this precautionary dose be? Will the third dose be Covishield for people who've taken Covishield and Covaxin for people who've taken the first 2 doses of Covaxin?
So this, I think, will come out gradually. We don't know what recommendations the NTDAGI, the task force, is going to give on this. However, outside, abroad, I mean, people have mixed the vaccines. They have seen good results with mixing as well. So we don't know what recommendations the NTAGI will give on this. But yes, the precautionary dose which the Prime Minister is saying is actually the booster dose. And it is going to boost the immunity, both for the frontline and those who are above 60 with comorbidities. So whether it will be allowed to mix or not allowed to mix, that I can't say. That's a policy decision that will come from the task
force. We'll know about the policy decision, but Dr. Bagai, what we do know for sure is the date of the rollout. So 3rd of January 2020 is when rollout of vaccination for people aged 15 to 18 will begin. From 10th of January, frontline workers will get their precautionary dose. Also, senior citizens with comorbidities on advice of doctors.
Absolutely. I think this is the best pre-New Year's gift which the Prime Minister served citizens. If you look back in the last year, there has been no country which has even remotely matched India's immaculate and precision protocol-driven science-based immunization covered 140 crores. And that's the real reason we've been able to keep these variants largely away. US and Europe is under the fifth wave now. And they're almost astronomical. But I think we cannot be complacent. We cannot believe in mischief mongering. We cannot believe in naysayers. Believe in medical science. Believe in the government. Push the vaccine campaign very aggressively. The pediatric campaign will have a huge arm, which we will rapidly. Now it's actually going to be a twin engine. So it's going to be the adult population and the pediatric population. So I see no reason why by middle or end of Jan we will distinctly reach a very good level of community-acquired immunity. Over to you, Pranesh.
Right. Dr. Monica Lange, emergency medicine practitioner, also joining us. Dr. Lange, what do you make of the decisions announced by Prime Minister Modi? I think we are having a few issues with that line, but Dr. Manan, I want to bring you back again and let's talk about the rollout, because prior to the announcement, we were talking about confusion, the delay in rollout. Here the Prime Minister has set a timeline that the government now needs to follow.
So, it's very simple. We already have a very robust immunization program which is being carried out by the Government of India. They can be utilized in the government sector. Plus, I am very hopeful that this vaccination will also be provided to the private sector. That will make the accessibility very easy for all kinds of people to take this vaccine. It should not be limited to a particular center or a particular, community. Already we are giving so many immunizations to children. So with that, this vaccination, tagged along with that will make it easy. I'm very hopeful that, the private sector also gets this vaccination and we are also able to administer to children. So, a lot of people who hesitate to go to certain centers may come to the private sector. So, it should be in an overall manner. Hopefully that should happen.
While the precautionary dose will certainly boost our immunity, the important thing that the Prime Minister underlined, and something that, Times Now as a platform has been stressing on, is WMD, washing, keeping your mask on and distancing. The Prime Minister stressed on it in the address too. Dr. Manan.
Yeah, and one more thing he said, very important. Dar, bhram or afwah, unnecessary panic and fear mongering, that kind of, a situation is being created. He said, jo log aisa karne ka prayatna kar rahe hain, us pe vishwas na kare. So that means he is stressing that there are people who are trying to create an environment of fear in the country, and we should not trust and believe them. We should believe in science. Just follow whatever you said just now, social distancing, hand washing, masking, simple COVID protocols to be followed, vaccination to be taken, no panic, eat good food, exercise well, keep yourself fit. And with the vaccination program already going so well in the country, I think one of the best in the world, I think we are in a good situation. We'll be in a better situation next month. I'm very hopeful of that.
And sir, before I bring you in once again, I want to quickly play out a short speech of Prime Minister Modi. This is about 3.5 minutes. This is where he sums up the three announcements that the government has made. And come December 2020, we will have the booster dose being rolled out, as also vaccine for kids aged between 15 to 18.
साथियों, हमें इसको और गति देनी है और विस्तार देना है.
The vaccination drive will be expanded from January. That's the super news break you heard on Times Now First. A short break. We are coming back to this. Dr. Manan, I thank you for joining us, sir.